Hi, Victoria here. I'm excited to bring you the second part of Phil's core therapy treatment. Please subscribe to the channel and welcome as a fly on the wall in my bothy therapy room, where you get to see Phil's second part of his treatment. Stick to the end to see whether he passes the tests that he'd previously failed, the kinesiology tests, and to see how he feels, whether he's moving well at the end of the treatment. Okay, see you soon. So, welcome to the bothy therapy room. I invite you in as a fly on the wall to watch Phil's second part of his treatment. In the first, you will have seen the kinesiology muscle testing to see how he presented this day. Then you get to see the tweener massage, the shoulder work, the leg repatterning and the sacral float, the qigong. Now he's just turned over and I'm checking his alignment, but also working on his feet, his toes, soles. I'm using my thumbs down the center line of his foot, which is actually the reflex point for the whole spine. And I'm also working around the sides of the ankles because he's had a left Achilles rupture. I'm aware that Phil may be a little uncomfortable with this. That's why quite often clients will shift around once they first turn over in order to resettle the body. And because of that Achilles pain and lack of mobility that he's had for a few weeks now, this has meant that any work on this area may feel a little bit new, a little bit uncomfortable perhaps, and yet it's well received. It's the sort of feeling you get that feels like a relieving pain, one that needs to happen, sort of pokes the pain a little bit and gets rid of it. Working around the whole side, the lateral whole outside of the foot and ankle, in order to relieve any tension of the muscles and fascia around that Achilles. This is what can happen quite frequently with any issue in the body, not just the Achilles, whereby other tension and lack of alignment perhaps with bone and muscle will lead to too much strain in a different area. And that may be what's happened in this area. And of course, Phil is quite a sportsman. He enjoys tennis and golf particularly, which are both one-sided sports. They're not symmetrical. And so this may well have been putting too much strain on those finer joints, those finer fascia ligaments. So I've now propped up Phil's left knee with my knee in order to create heat underneath the knee. I've got my hands on top, creating that dual targeted effect of heat and qigong, but also to bring the knee into a soft alignment so it's not locked. You may notice I'm moving around a little bit. That's as I sense the energy coming from Phil's knee. You notice also that Phil's stopped moving around quite a lot now. This will be because of the energy created when Qigong is happening. It's such a profoundly intense, relaxing effect on the whole body. Phil will now be experiencing quite a lot of heat in the knee. I'm just working my thumbs around the outside of the joints. And now coming to the top of the body, the head, shoulders, neck, the scalp. The reason I worked on the left knee just now was because you'll have noticed in part 1 of Phil's core therapy treatment, it was his left knee and left ankle that failed the kinesiology muscle test. And that's why I then tested all the different angles of the knee before working out exactly which area needed a little assistance. Now, most people I treat absolutely love the neck area being treated. I think most of us have tension in our necks caused by incorrect posture, maybe too much strain in one position, either driving or at a desk or playing sport. And so by bringing the correct alignment, the correct targeted relaxation and energy between the vertebra in order to lengthen that neck or that spine, then this ensures the most amazing amount of relief and therapy for the client at this stage. It's so utterly relaxing that that's why, as core therapists, we treat the neck almost last in the core therapy treatment. The rest of the body will have been relaxed, helping the head and neck relax. You can see my fingers there just supporting and protruding into the area between C1, which is the very top vertebra, and the occiput, which is the base back of the skull. A lot of people have issues at that joint where the C1 may well have clamped tight against the occiput. This can happen in various sports, or trampolining, or falling over, whether as a child or an adult. Also as a whiplash and a sudden stopping movement in the car when our head flips back. And what unfortunately happens, well, actually fortunately, is that the C1 can attach itself quite beautifully, like a jigsaw piece, underneath the occiput. This has the effect of protecting the neck from breaking, but if left untreated, that C1 can remain attached to the occiput for many, many years, if not for life. It will then, over the time, affect mobility and flexibility. It may not even create pain, but it does in many people. And it leads to all manner of blockages, physically, but also mentally. For instance, headaches, lack of clarity. The glands may not work so well. For instance, the pituitary, which controls the release of all the hormones, the whole endocrine system. So that may include adrenaline from our adrenals. It may include the reproductive system. So even something simple like a neck release can help us in so many ways, hormonally and with reproduction, also with our stress levels, because of helping to create a balanced amount of adrenaline being ejected into the body. Also with the thyroid, because of the thyroid gland emitting thyroxine. And how interesting, so many of us these days do suffer with a hypo or hyperactive thyroid gland, and all it may need is a neck release to help that pituitary gland to give the right signals to the thyroid. It's worth getting it checked out. So, having done a couple of neck releases where I've supported the very upper part of the neck with protruding fingers between the top vertebra and the occiput, I'm then helping to relax and push down away from the head and neck, those shoulders. You see Phil's head gently moving as I stretch the deltoid, the shoulder away. That's a really good sign. So while I'm supporting his head and neck with one hand, I'm also feeling the whole time what his head and neck are doing, whether they are giving in the muscle department, whether they are allowing and bouncing back. And that's a really good sign. That's excellent. It shows that there is some softness to the muscle, that it isn't hard and tight, strained. Now moving on, having treated the muscles and bones with the neck release and shoulder release, I'm now moving on to the Qigong, where as core therapists, each Qigong treatment is called a float. So I am floating Phil's neck. It now feels really warm. There is an immense amount of heat and energy there. Phil's body and breathing has now reached a beautiful, optimum level of relaxation. His shoulders are relaxed, his posture already, even in this lying down position, is much better. As I work on this area, I'm always looking down the length of the body as well to check his alignment, that the hips, knees, the feet and his chest are not twisted in any manner. For instance, with torsion, where a muscle might be tighter on one side than the other, and therefore bringing the angle of that body part over to one side. And whenever I do find something like that, I'll always work on that area. So I will not only work on a tight muscle, but I'll also make sure that the other side, maybe a slack or muscle that's too loose, isn't not working in some way because of a lack of connection. Sometimes, for instance, with a muscle, they can have a start and an end of a muscle, which is called an origin and an insertion. And sometimes one end of that muscle may have levitated away from the bone that it is connected to, and will need reminding how to reattach. And that is a technique I think I've shown you on here with Mirka's core therapy treatment, called the origin and insertion technique. You'll notice within this Qigong treatment now that I have moved my thumbs up to touch the sides of Phil's temples. My hands are still relaxed around his upper neck and scalp. So I'm working on the occiput, the very top of the vertebra, and the temporals. I've got my eyes closed, and I know, without even asking Phil, that we are now tuning into exactly the same energy. It takes quite a lot of energy to create this beautiful feeling that does work between us, where I am simply facilitating and activating that energy that's always within us, and in this case it's within Phil, and reminding that energy, that beautiful life force, that it does have the power to relax and heal at the same time. And this energy will carry on working for Phil for several days after this core therapy treatment. And we are left with the most beautiful feeling of tranquility. Having updated my notes, I'm now asking Phil to take a couple of breaths, keep his eyes closed, and start having a sense of awareness, sensing his body, becoming aware of the room, becoming aware of how his body feels after a core treatment. Phil and I have taken several breaths together, and now I'm just asking him to become aware of his toes, his soles, and to just start giving them a little movement. And then to rotate into his ankles. I notice this a lot. A lot of people aren't particularly keen to start moving after a treatment. They're in such a relaxed state that their body is telling them that they should stay there for longer. And I understand that. Sometimes with people, if they're very relaxed, I will leave them for a couple of minutes and come back. But at some point, they do need to take ownership back of their physical body again, move into it, and be supportive, be present in the rest of their day. And now asking Phil to relax and move into his shoulders, rotating into the shoulder blades, moving into the hands, stretching the palms, circling the wrists. It's a really good action. You may want to follow along and do these actions at the same time. And breathing into the whole torso. And then when he's ready to, I invite him to raise his arms over his head for a nice long body stretch. It gives me the opportunity to stretch out and breathe, move into and rotate all of my joints, spine, at the same time as I talk my clients through their awakening. Having awakened the body, I'm now checking my notes to see which areas I need to retest that had failed at the start of this particular treatment. So this is a kinesiology muscle test. That was called an IPSY test, which is one-sided, one arm and leg, which had failed at the start of the treatment and it was strong. This is called a contralateral, which is now strong. That's a really good sign because that also shows that his left knee and left ankle are now passing. So that means I don't need to test those because the contralateral showed me that they will pass. This is a ballet test and it actually shows me whether the hip, in this case the right hip, is happy opening. I've got the foot positioned nearer to the knee and now asking him to relax his knee, his leg down, and to raise his left knee just to that middle position. And I ask him to hold his arm once he's relaxed the knee out. I ask him to lower his arm, it was too high, which I find a lot of people do raise their arms very high at that point. And he's passed all his tests, I'm really happy with that. So thank you for joining me. I see you again soon. Next week you'll be seeing my own core therapy treatment. Please subscribe. Thanks guys.